ensure that the COVID-19 pandemic is defeated. One of the key facets of response touches on coordination, and again, in the spirit of taking stock on how we have coordinated the response of COVID-19 in the country, we continue to employ what is known as a whole-of-society approach, an approach that consists both of whole-of-government participation as well as multi-agency approach. And this is in accordance to the Executive Order number 2 that was issued by His Excellency the President on the 28th of February. The National Emergency Response Committee continues to meet regularly. It continues to offer policy direction with regards to the response efforts. Our technical committees also continue to coordinate this approach, and as we've mentioned, it is a multi-agency team having participation both of the public and private sector, state and non-state actors. Our Public Health Emergency Operations Center is a crucial role of COVID-19 response, and as we evaluate and see the performance of this center, we note that the center continues to provide a coordinated response. From the very first day we reported a COVID-19 case to date, we've received daily situation reports, spanning information from each and every county to sub-county level with regard to COVID-19. The Operations Center that houses our rapid response teams and contact tracers continues to be on standby on a 24-hour basis to be able to investigate any alerts, to follow up on any contacts of confirmed cases. And this is being done in close collaboration with the World Health Organization country office. There's a lot of building of capacity of sub-county rapid response teams and contact tracing teams to enhance that capacity is maintained when it comes to investigating alerts. We continue to train. In fact, we have re-embarked on what we are calling retraining. So this is a second and third round of training, whereby 21 counties shall now be undergoing retraining when it comes to the management of an emergency operations center at that center. In terms of diagnostic capacity in the country, we have managed to make strides from the very beginning. To date, we have 33 laboratories that are conducting testing. These are constituent of both public and private laboratories. We have testing facilities available in the following counties: in Nairobi, Kisumu, Mombasa, Kilifi, Wajir, Kericho, Uasin Gishu, Machakos, Busia, Nakuru, Kajiado, and Trans Nzoia. They're all doing COVID-19 testing. And in terms of laboratories, it becomes important to remind you that the National Influenza Center, the National HIV Reference Laboratory, that form part of the National Public Health Laboratory Framework are conducting testing. Kenya Medical Research Institute laboratories in Nairobi, Kilifi, Kisumu, Alupe are all conducting testing, including Cambridge CDC laboratories that we have, again, in Nairobi, in Kisumu, Walter Reed, Kericho. We've also partnered with different facilities. We have laboratory facilities present at ILRI. We have KNH offering testing facilities, MTRH, Coast General, Wajir County Referral, Machakos County Referral through the architecture that I've just described, Busia, Kitale County Referral, Malindi, Aga Khan University when it comes to the private sector, Nairobi Hospital, Lancet, Amref, Mombasa Hospital, KU, all these, and IOM, as well as Pathcare Kenya Limited, all have diagnostic capacity. And this is a great improvement 154 days later. In addition to this, we have deployed mobile laboratories. These have been deployed to different border points. Maimayu, Namanga, Malaba border all have testing capability there and continue to support diagnostics when it comes to COVID-19. In terms of screening, like I mentioned, we remain alert at our border points, at our points of entry, and as we continue releasing new protocols and guidelines, we continue to implement mandatory screening of cargo vessels, of crew who are coming in, and cumulatively to date, we have screened around 800, a little over 800,000 individuals have been screened across all points of entry. And even as we move towards opening of airspaces, as we've done Stringent protocols are underway. I'm happy to report we've received good reports of adherence in terms of the different airlines when it comes to ensuring that these protocols are effective as an infection prevention control measure. We continue then to impose physical distancing restrictions. Curfew continues on with good success, and we shall continue ensuring that the response is heightened. In terms of isolation and quarantine facilities, we've been able to identify these facilities across the 47 counties, and most remarkably, Kenya is now being loaded. I'm aware yesterday there was a meeting between different countries across the world, and Kenya was there to showcase its home-based care program that has been deemed a success in the fight of COVID-19. With regards to personal protective equipment, gains have been made. Distribution of kits has been done to different healthcare workers. Our local industries have been boosted and are able to produce good quality PPEs. Community involvement, no time like any other, has the country done exceptionally well when it comes to implementing the Nyumba Kumi initiative. This initiative has been able to support outbreak response measures. We continuously get success stories where we have heightened alert levels at the community level. People are able to identify who is coming in from Nairobi, and they're able to ensure that there's adherence to the measures. To date, I'm informed we've reached about 34 million community members with COVID-19 messaging, and we continue to ramp up our risk communication and evolve it into what we are calling behavior change communication, ensuring that we are moving from simply disseminating information to ensuring that our approach actually causes a change in behavior in the population. Masking continues to be a key strategy when it comes to ensuring that we win this fight. And here, perhaps, we have a mixed response. We've continuously said that while some parts in the country exhibit good adherence, more remains to be done at the level of personal responsibility in ensuring that we are all masked. And so really, when we do take stock and reflect over what we've done, we remain proud as a country. We've made gains. We continue to make gains. We continue to invest further in this area to ensure that we're able to defeat the COVID-19 pandemic. And we do believe that the measures we have put in place have contributed to the low mortality rate that we have, and therefore the government will continue to do what it needs to do, and Kenyans are encouraged at all times to adhere to the set guidelines and they develop protocols in order to remain safe and healthy. With regards to our COVID-19 statistics today, 650 people have tested positive out of a sample size of 6,768 samples, all collected within the last 24 hours. It now brings the total number of positive cases to the country to 28,754. Of these cases, 633 are Kenyans, whereas 17 are foreigners, 391 are male, and 259 are female. The youngest is a 1-year-old baby, whereas the oldest is 97. In terms of distribution by county, Nairobi leads the pack at 356, Kiambu has 53, Nakuru 48, Machakos 26, Kajiado 20, Busia 20, Uasin Gishu and Laikipia have 15 each, Bomet 10, Bungoma 9, Migori, Mombasa, Kisii have 7, Tharaka Nithi has 6, Murang'a 5, Narok, Turkana 5, Kericho, Makueni, Kitui, Samburu have 4 cases, Embu, Baringo and Nandi have 3 cases, whereas Kisumu, Mandera and Marsabit have 2, Isiolo, Trans Nzoia, Nyamira, Elgeyo Marakwet and Nyeri having 1 case. We are happy to inform you that 490 patients have recovered from the disease, of which 308 are from the home-based care program, whereas 182 have been discharged from various hospitals. And so our total number of recoveries is 15,100. And we continue to extend our appreciation to our healthcare workers who have made this great achievement possible. And on a sad note, 4 patients have succumbed to the disease, bringing our fatality count to 460. We do continue to extend our sincere condolences to the families and friends of those who've lost their loved ones. We thank you. Q&A. Fantastic. Huh? Oh, here we go.
Thank you very much. Elfas Legat from Citizen TV. And Dr. Mwangangi, you mentioned that Nairobi remains to be the epicenter with more than 16,000 cases. Would you be a bit more specific as to where are these numbers across the city? And another question is to the DG. We've seen, is there any data as to the effect of survival chances of patients? Because there is an apparent presumption that the sooner that you go to the hospital, the higher your survival chances. Is there any data to that effect, whether you're more to survive the virus and or fatality, the rate of fatality in that sense? And at what point should someone go to the hospital when with regard to the symptoms of COVID-19? Thank you.
Nancy Okware from KBC. My question is on the home-based care program, given that in the recent days we've been seeing that it's been a success given the number of recoveries being recorded in a single day. And there's a day that you said you are embarking on a mission to train household members so that they can be taking care of their kin who may be ailing and undergoing the home-based care program. So where are you in terms of training these home care, family members, and also in terms of the community healthcare workers, how many have been trained so far? Because we are still receiving complaints from some who are undergoing the home care program that they are not being taken care of by the community health workers. Thank you.
Thank you. Thank you for the questions. So we've had a question on the 16,000 cases. Where are these numbers from? And also a question on the data in terms of when do you seek care? Do you have any information or data on when it is important for you to move perhaps from the home or to be able to get care in a health facility? Now, in terms of the cases and the numbers that we have, like I mentioned, we have what is known as an emergency operations center. It's a center that is nested at Afya Annex, a building next to Kenyatta National Hospital. And at that center, the team sits there and receives alerts. And these alerts can look in, a number of ways. It can be an alert that we have a person here who is a positive contact of a confirmed COVID-19 case, and we need you to come in and take a sample and then run a test. So that's one way of getting the numbers. We do also have institutions and routine surveillance activities that are happening across the country, particularly in Nairobi, where again we're able to go in and identify a number of people, take their samples and test. So there's a wide array of where these samples are coming from. These are not, and I insist and repeat, these are not manufactured numbers or cases. We actually have a very elaborate team of rapid response team members, 24 hours, who are out picking samples when they get their alert. And in terms of, I think, and this is the more technical question, and the DG will add on, in terms of when do you seek care, the DG has been clear and he will explain that it all depends on the symptomology. When you have a normal flu and you're at home, sometimes you're able to weather that and take care of yourself. But when it comes to a point where you're having difficulty breathing, you're having a high fever, it means you're somewhere in that tangent where you would require some form of care in a hospital setup, care to manage your symptoms, your high fever. Remember, having a high fever can have other effects other than just COVID-19. And so we want to ensure we are controlling your fever, we are controlling any other symptom that you have, but we are also working to reduce your progression from moderate to severe disease. That is how we determine who we admit. And our clinicians are trained. It's fantastic. I've seen just last week, WHO released an online module of training, and they released it globally. And so a clinician is able to determine, is this an admission case, or is this a case that can be managed at home? But DG will elaborate on that. In terms of our home-based care program, yes, like I mentioned, this is a program that was being celebrated yesterday across Africa. We had people from Ghana, South Africa, really trying to find out what are we doing, how are we doing this, how are we getting success from this program. We do have home-based care guidelines and protocols, and these are available on the ministerial website. And yes, we've had the call to be able to train, to be able to, teach our mothers, our daughters, our aunties, our caretakers, how do you protect someone when they have COVID and they're under this program. What we will do going forward, and in consultation with the case management team, we will see how else can we deploy this. it becomes important to notice that there are constraints when it comes to putting together people in a room to train them, particularly when the people are everyone in the country who requires to know how a home-based care program is run. And so we shall explore and see, do we have an online module, a modular format, where you're able to see how do I clean my dishes when I'm having home-based care? How do I prepare 0.5% jig? That's an important component of home-based care. How do I wipe my kitchen countertop? How do I disinfect our clothes, our bed sheets, our linen during the home-based care program? So we'll put in together an online module and ensure it's transmitted using all government channels so that all Kenyans can have that information. With regards to CHVs, the last count I had, we've trained about 34,000 of them across the country, and we continue to train them in terms of ensuring that they're able to support both the aspect of behavior change communication and also supporting the home-based care program. I'll invite the DG to add on to this. Karibu, DG.
Well, thanks, Madam CS. The first question from Elvas regarding survival rates. Yes, of course, survival rates will definitely improve the earlier I report to a health facility than a late presentation to the health facility. And what will make you go to the health facility, of course, are the symptoms Madam CS mentioned. That is a high fever, persistent dry cough that is not resolving, and of course difficulty in breathing. Remember, this is a multisystemic disease. Of course, the first point of attack is the lung, but eventually it will affect most of your organs. And there's also this concept of silent hypoxemia, or what the lay people call happy hypoxia, where your lungs are already affected, and ordinarily you'd be having difficulty in breathing, but for SARS-CoV-2, you have very low oxygen saturation levels, but you otherwise appear well. But when you land in the hospital, you're taken straight away to the critical care unit. So it is important that as soon as you start feeling these symptoms, you get hold of your healthcare provider to seek for assistance before a lot of damage is done. Many a times, if you report early and you don't have any coexisting medical condition, the management usually you end up with a better outcome than late presentation. And this is what we have tried to ramp up, especially with our case management team, and of course with the data that we generate from our own cases. Remember, initially we used to rely on data from outside, but because of the high caseload that we have now, we have experience in our critical care areas and isolation centers on what best mechanism or what best platforms to use in management of these cases. So it is very, very important that as soon as you feel unwell, please don't just sit at home. You report to a health facility at the earliest opportunity so that you can be assisted. Again, we'll continue celebrating the achievements that you have made regarding home-based care. As we told you, it is cheap, and it also removes the responsibility of people being in the institutions or healthcare facilities, so that we reserve those ones for those with severe or moderate, severe or critical illnesses. And it has worked very well. So far, more than close to 60% of our recoveries have been from home-based care. Even though our recovery rate lags behind the global average, this is just because of reporting like today. The figures we have given to you are basically reports of discharges from 23 out of the 47 counties. And of course, we cannot delay the pressure because we have to wait for the figures. So going forward, you'll see our recovery rate match and probably even exceed the global average, more so that 90% or more of our cases are asymptomatic. So this is a platform that we are going to use going forward, strengthen further. Once we are done with the training of community health volunteers, we'll then be able to use them to be able to train members of the household at community level, especially as we approach our peak. Thank you.
Thank you. Thank you so much.